Everyone has a heart, but in Canada, the hearts of just over half the population are under-researched and overstressed. Heart and Stroke Foundation of Canada reports that heart disease and stroke are the #1 cause of premature death for women in Canada. Still, half of women who suffer a heart attack have their symptoms go unrecognized. Heart and Stroke reports that 2/3 of all research on heart disease and stroke has been focused on men. I decided to find out more about why women got left out of that research. I started by talking to a health equity specialist from the Heart and Stroke Foundation of Canada.
In the past, there has been concerns around including women because women's bodies are often viewed as complex or overly complex to study. Women are not just small men. We have different, again, those kind of sex-related differences in our bodies, as well as the gender-related differences in terms of how we experience things and how we access care treatment.
She filled your heart when it was empty, and she lived to protect it. But who's protecting hers?
I got the diagnosis because I had had a couple of cortisone shots for my knee. I'd gone on holidays and just did not have couldn't sleep laying down. It was just a very uncomfortable feeling in my chest for about 5 days. And when I came back, I went to my doctor and I said, let's not ever do this again. That was not enjoyable. And then we started talking about my family heart history.
Men are more likely to just report pain in their chest during a heart attack. Women, though, are more likely to have more than one symptom. They often report pain in their neck, jaw, shoulder, upper back, and upper belly. Women can also often experience nausea, vomiting, and shortness of breath. In Canada, only 11% of women can name one or more risk factors for heart disease or stroke that are specific to them. When it comes to risk factors specifically, it's important to define what we mean when we say women versus when we say female. Heart and Stroke defines woman as a gender term, describing someone's personal experience and self-identification. According to the Heart and Stroke definition, female describes a person's sex, denoting hormones and chromosomes. I spoke with a scientist here at the University of Ottawa Heart Institute. She told me that female-specific factors like menopause and pregnancy are among the things that need to be taken into consideration.
When a female is pregnant, they can develop things like high blood pressure during pregnancy or diabetes during pregnancy. When we go through menopause and we stop naturally producing estrogen, our increase, or rather our risk of heart disease goes up.
Heart and Stroke reports that risk factors that affect everyone include smoking, high blood pressure, diabetes, obesity, physical inactivity, and depression. But they can often have a greater impact on women especially. Women-specific risk factors include some oral contraceptives and polycystic ovary syndrome. Also, trans women can be at a higher risk if they undergo gender-affirming hormone therapy. The Canadian Women's Heart Health Centre offers a peer support group called Women at Heart. Gail has been a peer support group leader since 2017.
I have had too many women in my peer support groups who have actually even told doctors that they have heart issues in their family. They have asked for a stress test and their doctors have said, nope, no, it's just menopause, you don't need one. And then they go and they have a heart attack. They just don't feel that they're being listened to. And for many of them, it didn't have to end up in a heart attack. It just didn't.
Many institutions across Canada are trying to close the research gap by considering sex and gender in their studies and working with women with lived experience.
I actually had a story from somebody that many years ago had been in a group, and she said that there was a friend of hers that she had told about symptoms, And it was based on that woman took herself to the hospital and found out, yeah, she was having a heart attack.
The reason why we do research is to improve care and outcomes. And so what's really important as the sort of final step or, near final step of research is getting that knowledge out there.
At Heart and Stroke, we're continuing to fund the people who are doing that research. We're continuing to fund the projects that are creating the knowledge that we need to change the system.
The Canadian Women's Heart Health Centre and Heart and Stroke will hold the 5th Canadian Women's Heart Health Summit this April to keep driving forward change and closing the health gap.